Hearty welcome to this phone living program being organized by Tele Center for Persons with Communication Disorders at All India Institute of Speech and Hearing, Mysuru. I am Spurti Tamaya, working as lecturer in the Department of Audiology. I'll be the moderator for today's program. World Health Organization has recognized March 3rd as World Hearing Day. The purpose of this campaign is to promote activities related to prevention of hearing loss and also to improve hearing healthcare facilities across the globe. Joining hands with World Health Organization and also Ministry of Health and Family Welfare, Government of India, AIISH has been celebrating World Hearing Day since many years. Even this year, that is 2021, we conducted various programs. This live phone-in program is one amongst them. Topic for today's discussion is rehabilitation of individuals with hearing impairment. To discuss with you, we have three subject experts here with me. To introduce them, firstly, we have Professor Dr. P. Manjula, Professor in Audiology. I heartily welcome you, ma'am, to this program. Next, we have Dr. Sangeeta Mahesh, Clinical Reader and also Head of the Department of Clinical Services. Warm welcome to you, madam. Thank you. We also have Dr. Yashodhara Kumar, Clinical Psychologist. Warm welcome to you, sir. I extend my warm welcome to Mr. Raj Kumar, Special Educator. Welcome to you, sir. Dear audience, I welcome all your questions. Please note the contact number is 0821 250 2530. Alternatively, you can reach us through dropping your questions in the Facebook comment section. To begin today's discussion, my first question is to you, madam. What is the importance of early rehabilitation?
Hearing is a very important sense that we have. Okay, so it is useful for us to communicate with each other, and also, like in the early years, we have to hear in order to develop speech and language. If we do not have speech and language, okay, a child with no hearing may not develop speech and language, and then in future the child may have problems in academic achievements at school, and also later on the child may also have problems in getting a good job and standing on his own feet. So this way the child will also lose opportunities in terms of socio-economic areas, and he will have a lot of problems in the life. So in order to avoid all these problems, if we identify the child early in life, okay, about his hearing loss, and do a detailed evaluation and do rehabilitation for the child in terms of providing them hearing devices such as hearing aids or cochlear implants, and then training them for speech therapy, language therapy and listening therapy, then the child will overcome all these problems. And if it is done early, before 6 months of age, okay, then actually these children will develop on par with any other child. So this is the importance of.
Thank you, ma'am. My next question is to Dr. Sangeeta, ma'am. Ma'am, what are the different kinds of speech language problems we can see in these children?
Yeah, so as Madam suggested, hearing plays an important role to develop speech and language as such. Okay, so see, since birth, the child would be exposed to hearing sounds and meaningful words. So the exposure to these sounds, basically the auditory area gets stimulated and gets stored in the memory, and the child starts using these words meaningfully. And these words are actually reinforced by the immediate environment. So further, the child would be using these words appropriate to the situation. Okay, so but then when the child has this hearing deficit as such, the child would have speech language problems. So basically, the child would have poor vocabulary or the limited vocabulary, and especially even if we teach them kind of training would be given, they would be using simple words. Okay, so abstract words would be difficult for them because explaining an abstract word is going to be a complex task. And also these grammatical morphemes like the plural markers, the tense markers and the possessives. So all these markers will be even more difficult for the child to understand and express. Okay, and then along with this, they would be using simple sentences also or shorter sentences, and they would also have issues in articulation. So some of the difficult sounds would include s, sh, k, g, then your r. So all these sounds are actually late acquired sounds. Okay, so these sounds would be really difficult for them to produce, and some of these sounds like k, g are not visible. So those sounds which are not visible is going to be difficult for the child to acquire. So then they generally substitute a sound. So for example, for the word, cap, they may say it as tap. Okay. So and then they might leave a sound if a word is given, like bat is given to them, probably give a chance to say it, they may say it as b only. That is, they might omit a consonant in a word. So this way they simplify the word as such, or they omit a word or a substitute a word. So these kind of errors would be there in terms of pronunciation error as such. And then they can also have prosodic problems. Okay, so that is the inflection that we use, the stress that we use is not appropriate in them. They may not be using the pauses appropriately in the sentence. Okay, and there are also chances that they can have voice problems. Generally, it is seen that a child with hearing impairment can have high pitch, and the loudness as such may be too loud or maybe too soft as such. And the quality of voice also is not going to be smooth like a normal child. So all the language components are basically affected in a child with hearing impairment because they don't get adequate auditory feedback, okay, from the immediate environment, and also that self-auditory feedback is affected in them.
Thank you, ma'am. Now we learned that children with hearing problem not just have hearing problems but also various speech language problems. Sir, my question to you is there a possibility that these children develop behavioral issues also?
Yes. But one thing we should understand is not necessary that there is no rule that all the children with hearing issues will have or should have the behavioral issues. In fact, it's quite common we can see behavioral issues even in the typically developing children also. So on that reason, we should understand that what is playing as a mediation or mediator factor. See, as we know that here a child with hearing issues already having an issue with auditory cues. So child is not able to receive auditory cues from the environment. As well as Madam pointed out, there is a communication issues. So obviously, whatever child wants to communicate, child may not able to communicate with a proper language issue. So that definitely leads to an behavioral issue. For example, take an example. Kids are playing together, and one child likes.
We'll continue the discussion after
Yeah.
this also. We have first caller for the day. Hello. Hello.
Hello, ma'am.
Namaste. Heli.
Ma'am, my name is Amrita. Hello.
ಹೇಳಿ ಅಮೃತ, ಕೇಳಿಸ್ತಾ ಇದೆ ಹೇಳಿ.
Okay. Ma'am, can I speak in English?
Yes, you can speak in English.
Ma'am, I have a case. My child is, I know he has profound hearing loss
Okay.
and developmental delays also there.
Okay.
Right now he's around 4 years.
Okay.
Hello.
Yes, yes, Amrita, please continue.
Okay, ma'am. So doctors have suggested, like we have tried hearing aid since 3 years,
Okay.
but it is not at all benefiting for him.
Okay.
So doctors are recommending for cochlear implant. I want to know, should I go for it or not?
Okay.
Because hearing, so many parents are worried about difficulties of the cochlear implant. It may not be benefiting and all.
Okay.
So I want to know if it will be fine for my child.
Okay. Amrita, to answer your question, we have subject expert, Dr. Manjula Madam. Madam.
Okay.
Amrita, you said your child is 4 years and then the child has been using hearing aids for 3 years.
Yes, ma'am.
Yeah, so I assume that this hearing aid was assessed by a qualified audiologist and prescribed to him, and he is attending the training sessions for speech, language, and listening development.
Yes, ma'am.
Okay. So, in spite of all these appropriate measures, so if the child is not able to develop speech and language skills and listening skills, then the child may be a candidate for a cochlear implant, but we have to confirm that, because it's not just the limited benefit from the hearing aid that will let us know that the child is a cochlear implant candidate or not. But there are other issues, such as if we have to do a radiological investigations in terms of CT scan and MRI scan and find out if the hearing nerve is okay. Because in a cochlear implant, the stimulation goes right to the hearing nerve. Unlike in a hearing aid where the stimulation goes through the external ear, middle ear, and the inner ear. Okay, with the cochlear implant, the stimulation goes to the hearing nerve directly, the electrical stimulation. So we should confirm that the hearing nerve is normal or near normal. So this can be confirmed through CT scans and MRI scans. And once that is done, and once the condition of the hearing nerve is confirmed, then we can decide about going in for a cochlear implant. So we advise you to consult an audiologist who is experienced in the area of cochlear implantation and an ENT surgeon in this aspect.
Amrita, is there anything else you want to ask?
Yeah, I just wanted to know about.
Okay. Okay. Thank you, Amrita.
Thank you. Thank you, sir.
If you can.
Yeah, yes, I was talking about how behavioral issues can exhibit in a child with hearing issues. So taken an example that a child with hearing issues and language issues, even in fact expressive language, child put together and they'll be playing collectively, and with one child is hearing impaired. Obviously, child is not having any expressive language, but child likes somebody's toy. So, and of course, child really want the toy. So, how child will express? So, obviously, child may not pick up any language. Child may try to snatch away that toy. So, in fact, that is how the child may pick up the behavioral issues. So, this is how child may develop. It's not basically behavioral issues according to me what I say. So, until unless we correct these language issues or hearing issues, so definitely child will have this. Otherwise, we have to teach a child with the way of communicating with maybe other modality. Can be sign language or can be other things. So again, the problem is not everyone good in understanding or interpreting sign language. So that is another aspect. So all this can influence our thing. Of course, there are studies saying that majority are children with hearing issues exhibited the attention deficit issues. So it could be probably, since they are very unlikely get any auditory cues. So there will be and they'll be more dominated on visual cues. So obviously visual cues, like it's a more prone to distractions. So that could be the reason that they show that hyperactivity or the more active or more there will be less in the attention span. So this how child may exhibit the issues.
Thank you, sir. Madam, my question is to you. We usually see that parents, they identify children to be having hearing problem. In spite of that, they tend to delay because of various other factors. They delay the treatment. So how early should they take the treatment? Is there any standard regarding that?
Yeah, usually parents will have a notion saying that the child should be normal. Okay, so they keep going from one place to another place until they get the answer saying that the child is normal or the child doesn't have problem. But actually, if the child is actually having a problem, it's better to go in for intervention, early intervention, as early as even a few weeks, because now the technology is so advanced that the hearing loss can be identified even at birth. So this hearing loss can be confirmed by 3 months of age. Yes.
Hello? Hello?
ಹಲೋ ಮೇಡಮ್ ನಮಸ್ಕಾರ ಮೇಡಮ್.
ನಮಸ್ತೆ, ಹೇಳಿ ಸರ್.
ಮೇಡಮ್ ನಿಮ್ಮ ಹೆಸರು ರಮೇಶ್ ಅಂತ.
ಹೇಳಿ ರಮೇಶ್ ಸರ್.
ಮೇಡಮ್ ಇದು ನಮ್ಮ ಮಗುಗೆ ಹಿಯರಿಂಗ್ ಇದಾಗಿದೆ.
ಏನಾಗಿದೆ?
ಆಗಿದೆ, ಹಿಯರಿಂಗ್ ಇದಾಗಿದೆ.
ಓಕೆ.
ಸಾಕು ಅಥವಾ ಬೇರೆ ಏನಾದರೂ ಮಾಡಿ?
ಕಿವಿ ತೊಂದರೆಗೆ ಮಾತಿನ ತರಬೇತಿ ಅಷ್ಟೇ ಸಾಕಾ ಅಂತ ಕೇಳ್ತಾ ಇದ್ದೀರಾ?
ಹೌದು ಹೌದು ಮೇಡಮ್ ಹೌದು.
ಓಕೆ, ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಸಂಗೀತಾ ಮೇಡಮ್ ಇದ್ದಾರೆ. ಈ ಪ್ರಶ್ನೆಗೆ ಅವರು ಉತ್ತರ ಕೊಡ್ತಾರೆ.
ಅದೇ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಸಿದ್ದೀರಾ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ಸೊ ಅಫ್ಕೋರ್ಸ್ ಇವಾಗ ಮಾತಿನ ತರಬೇತಿಗೆ ಬರಲೇಬೇಕು. ಮಾತಿನ ತರಬೇತಿನಲ್ಲಿ ಅವಳು ಪದಗಳ ಹೇಗೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದು, ಪದಗಳನ್ನು ಹೇಳೋದು, ಬಳಕೆ ಮಾಡೋದು, ಅರ್ಥಪೂರ್ಣವಾಗಿ ಎಲ್ಲ ಪದಗಳನ್ನು ಉಪಯೋಗಿಸೋದು, ಆಮೇಲೆ ಉಚ್ಚಾರಣೆ, ಈಗ ಕೆಲವು ಅಕ್ಷರಗಳನ್ನು ಉಚ್ಚಾರಣೆ ಮಾಡೋದಕ್ಕೆ ತೊಂದರೆ ಆಗ್ಬೋದು ಮಗುಗೆ. ಸೊ ಉಚ್ಚಾರಣೆ ಬಗ್ಗೆ ಗಮನ ಕೊಡೋದು. ಆ್ಯಂಡ್ ನಾನು ಹೇಳಿದೆ ಕೆಲವರು ಧ್ವನಿನೂ ಸರಿಯೋಗಿ ಇರೋದಿಲ್ಲ, ಧ್ವನಿನೂ ನಾರ್ಮಲ್ ಸಾಧಾರಣವಾಗಿರೋಲ್ಲ, ಅದ್ರ ಕಡೆ ಗಮನ ಕೊಡ್ತಾ ಅದನ್ನೆಲ್ಲ ನಾವೀಗ ಮಾತಿನ ತರಬೇತಿನಲ್ಲಿ ಮಾಡ್ತೀವಿ. ಅದ್ರ ಜೊತೆ ನೀವು ಶ್ರವಣ ತರಬೇತಿಗೂ ಹೋಗ್ಬೇಕಾಗತ್ತೆ, ಲಿಸ್ನಿಂಗ್ ಟ್ರೈನಿಂಗ್ ಅಂತ. ಮಾತಿನ ತರಬೇತಿ ಜೊತೆ ಶ್ರವಣ ತರಬೇತಿ ಅಂತ, ಲಿಸ್ನಿಂಗ್ ಟ್ರೈನಿಂಗ್ ಆ್ಯಂಡ್ ಸ್ಪೀಚ್ ಥೆರಪಿ ಬೋತ್ ಪ್ಲೇ ಅನ್ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್ ಇಲ್ಲಿ. ಯಾಕಂದರೆ ಮಗು ಕೇಳಿಸ್ಕೊಂಡ್ರೇ ಮಾತಾಡೋದಕ್ಕಾಗೋದು ಅಲ್ವಾ. ಸೊ ಅದರಿಂದ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ತರಬೇತಿ ಕೊಟ್ಟು ಮಗು ಕೇಳಿಸ್ಕೊಳ್ಳೋದು ಚೆನ್ನಾಗಿ ಇಂಪ್ರೂವ್ ಆದರೆ ಮಗು ಮಾತುನು ಅದೇ ಥರ ಸಾಧಾರಣವಾಗೇ ಇಂಪ್ರೂವ್ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ ಅದರಿಂದ ಈ 2 ಥರದ ತರಬೇತಿಗೆ ನೀವು ಅಟೆಂಡ್ ಮಾಡಬೇಕು. ಯಾವ ಊರು ನಿಮ್ಮದು?
ಚಾಮರಾಜನಗರ.
ಹಾಂ, ಚಾಮರಾಜನಗರದಲ್ಲೇ ಈಗ ಔಟ್ರೀಚ್ ಇಂಟರ್ನ್ಶಿಪ್ ಸೆಂಟರ್ ಎಲ್ಲ ಅಲ್ಲಿ ಇದೆ ನೋಡಿ. ಸೊ ಅಲ್ಲಿ ಅದೇ ಅಲ್ಲಿ ಚಾಮರಾಜನಗರದಲ್ಲೂ ನೀವು ವಿಚಾರಿಸ್ಬೋದು ನೋಡಿ. ಅಲ್ಲಿ ಹಾಸ್ಪಿಟಲ್, ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಅಲ್ಲಿನೂ ನಮ್ಮ ಸ್ಪೀಚ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಪೆಥಾಲಜಿಸ್ಟ್, ಆಡಿಯಾಲಜಿಸ್ಟ್ ಇದ್ದಾರೆ. ಅಲ್ಲೇ ನೀವು ನಮ್ಮ ಫೆಸಿಲಿಟಿನ ಅವೈಲ್ ಮಾಡ್ಬೋದು.
ಮತ್ತೇನಾದ್ರು ಕೇಳೋದಿತ್ತಾ ಸರ್? ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು. Sorry for the interruption, madam. Can we continue?
So I was telling you that the technology is so advanced that the hearing loss can be identified at birth in a hospital. Okay, our audiologist visits the hospital. In our institute, we have that program where the audiologist visits the maternity homes and all. They do hearing screening and identify the hearing loss even at birth. But this hearing loss which is identified has to be confirmed at least by the age of 3 months, and then early intervention like providing them hearing aids and starting of the training in terms of listening, speech and language training should start off immediately by the age of 6 months. So the Joint Committee on Infant Hearing has recommended that now they say that we have to identify the child as early as 1 month and start assessment and all should be completed by 2 months, and the intervention should start by 3 months. But in the Indian condition, this is slightly not achievable in the present scenario. So maybe we can go in for the 1, 3 and 6. That is, at 1 month we should be able to identify. By 3 months we should be able to confirm the hearing loss, and by 6 months we should be able to start off with the training after fitting the hearing aids. That should be the way.
Thank you, ma'am. We discussed that a child with a hearing loss can have various problems: speech language problem, hearing problem, and behavioral problem. So my question to you, madam. So who are all the professionals who will be involved in the treatment of such children?
Yeah, basically the rehabilitation of children with hearing impairment is a team approach. Okay, so the first and foremost we have the ENT professional, the medical professional who is qualified. Yeah, I think we'll take a call.
Hello? Hello?
Hello. Good afternoon, ma'am.
Good afternoon. Heli, sir.
I'm Sudhakar, ma'am, from Hubli.
Yes, sir.
My daughter is having full hearing loss, madam.
Okay.
She has 3 years old.
Sorry?
3 years old.
3 years.
3 years old, madam.
Okay.
I heard the government is giving some money to hearing impairment patients, madam.
Okay. Yes, sir.
I don't how to apply that ticket, madam.
Okay, sir. Dr. Manjula madam is here with us. She'll give us
Okay,
information about that.
Okay, madam.
ಒಳ್ಳೆ ಪ್ರಶ್ನೆನ ಕೇಳಿದ್ದೀರಾ ನೀವು. ಅಂದ್ರೆ ಈ
ಇಂಗ್ಲಿಷ್ ಕನ್ನಡ ಗೊತ್ತಾ ನಿಮಗೆ?
ಗೊತ್ತು ಮೇಡಮ್.
ಕನ್ನಡದಲ್ಲಿ ಹೇಳೋಣ, ಇಂಗ್ಲಿಷಲ್ಲಿ ಹೇಳೋಣ ನಿಮಗೆ?
ಇಂಗ್ಲಿಷಲ್ಲಿ ಹೇಳಿ ಮೇಡಮ್.
ಇಲ್ಲ. Okay. So this is a very good question. It will be useful for the others also. So if the child has got a hearing loss, we have to do confirmatory tests to confirm that the child is having what is the degree of problem that the child actually has. And then if the child satisfies the criteria that is given by the Rights for Persons with Disabilities Act, that is 60 dB and above, that is 40% of hearing loss. Okay, if the
Okay.
child satisfies that criteria, then the child will get a disability certificate. So this disability certificate has to be uh, given in your taluk office, where there will be an application. Along with that, you will have to attach your disability certificate, and that has to be, I mean, there they will approve the monthly maintenance amount, which will be about, for the hearing losses of milder degrees, it is about 600 per month, and for higher degrees of hearing loss, it is about 1,200 per month that they get. Apart from this, there are other benefits also which the child can avail at later stages. Maybe when the child starts going to school, the child can have a single language facility. That is, instead of learning 3 languages, the child can study in 1 language, and the child can get free hearing aids in case the child is from a family where the income is lesser than 15,000 per month. Okay, so like this, there are various other welfare measures that are available, provided by the government.
Okay, thank you so much.
Welcome, sir.
Yeah, we will just continue with the team of professionals that would be involved in rehabilitation of children with hearing impairment. So first and foremost, we have the ENT doctors, the medical professional who who's actually specialized in checking the diseases of ear, nose, and throat. They would be any kind of medical complications if present with these children, they would be looking into. So by prescribing medications, and also in case a surgery is involved, they'll have to be looking into that. Okay, so surgery and all that is their major focus. Also, most importantly, ENT clearance is a must to proceed further into the audiological evaluation. Then the second most important professional would include audiologist, who identifies the hearing loss and then examine the degree and severity of hearing loss, check on the further therapy protocol and all that. Before that, of course, the suitability of the amplification device. So the appropriate amplification device needs to be selected and suggested to the individual, and they will also look into auditory verbal therapy. Okay, and then we have the speech language pathologist, who would identify the speech language problems and then proceed with speech language therapy and focus on all linguistic components, such as the language, voice, fluency, prosodic aspects would be worked on in the child as such. Then other important personnel is special educator. Okay, so special educator is involved in education of the children with hearing impairment. So they plan for curricular modifications and classroom adaptations, and they can also guide the regular teachers to regarding the modifications that they have to adapt in a classroom setup. Clinical psychologist also plays an important role, as Dr. Yashodhar suggested, that some of the children might exhibit behavioral issues when they are in the normal group as such. So in case a child exhibits any kind of emotional problems, they would play a major role to boost their confidence and motivation. Family member, of course, is a very, very important member, wherein they'll have to provide an intensive support and an appropriate rehabilitation measure, accept the problem, and proceed as per the advice of the specialist. Okay, so overall, the team members would help to integrate, to mainstream the child into the normal society as such.
Thank you, ma'am. So we discussed about behavioral problems, how children develop behavioral issues, some of them. So is there a possibility they'll have cognitive issues also, development of cognition? Will hearing loss affect that?
Certainly. So the thing is, as I already told you, we in the learning process, any child for that matter, so we learn through environment, whatever the stimulus we get. So, but here with child with hearing loss, definitely lacking that auditory stimulus. So, whatever the learning supposed to be taken through auditory stimulus or auditory cues, definitely child will not receive that. So that will definitely hamper child's cognitive abilities. So of course, child will be using visual cues. But what happens is we and so-called person with normal hearing sensitivity, so we use both auditory as well as visual more, so that our learning would be better. So, but whereas in this issue, child with hearing issue, definitely child not able to, without hearing aid, child not able to use any auditory cues. So definitely that will hamper the learning of a child. So that will drag up the child's cognitive ability. And in fact, that's the reason we always, though child looks as if a child is having issues in the intelligence, but child may not be having issues in the intelligence, but child performing in the level of, or maybe below the average intelligence level, just because child is not able to express. So in that case, what we do is we go with a more of a performance-based assessment, so that child can perform, child need not orally answer for some assessments, so that we can check that. In fact, other than these, there are other issues child can exhibit, like depression or anxiety, for that matter. So with the developmental process.
Thank you, sir. We'll take another call. Hello? Hello? Hello?
ಮಾತಾಡಿ.
Hello, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
Hello. Good afternoon, panelists.
Good afternoon.
And good afternoon, ma'am. Ma'am, I'm Karen calling from Andaman and Nicobar Island. So, my question is, hello?
Yes. Please continue. We can hear you.
Yes, ma'am. So, actually, in Andaman and Nicobar Islands, we are 38 inhabited islands are there. So, we are very geographically challenged that one child is very far away from another place. And it is very difficult for them to seek help, especially children with cochlear implant and hearing impairment. So we have adopted few like camp-based rehabilitation approach as PBR. And is there any other community-based rehabilitation we can implement to improve their quality of life and improve their communication skills? Huh?
Okay. Along with us, we have subject expert, Dr. Manjula Madam. I request Madam to answer this.
So this is regarding, you want to know the ways in which we can help you in areas such as yours. So,
Yes, ma'am. Yes.
okay, actually, even when we are far away, okay, so if the child is already using a hearing aid or a cochlear implant, Corona has taught us a lot of things, including the online help.
Yes, ma'am.
So that
Actually,
way,
one thing before, ma'am, just small correction, because the thing is that in Andaman we have very poor net connection, ma'am. So our early rehabilitation is big question mark. Even a phone follows a huge challenge for us because of the network
Problems.
and there is no need to even ask about internet connection. We don't have. So we are basically doing a very ASHA work that we are empowering them to just follow. But it is very challenging. So is there any other way that I just wanted to add to that?
what we can also,
Are you aware of there's one outreach center there in Andaman and Nicobar?
Yes, ma'am.
Yeah. Are you aware of that? Have you visited the outreach center?
CRC, ma'am, Composite Regional Center.
Yeah.
Yes, ma'am. Yes.
Yes. Okay.
and then there can be several other online courses which can be downloaded, and the parent can be trained regarding how to use these online material, and the parent can in turn train the child. These resources are available in abundance in the net.
Oh,
Is there anything else you want to know?
no.
Okay.
Thank you.
Thank you. Madam, to continuing our discussion, we know that hearing loss can lead to so many problems. So what are the ways we can prevent the hearing loss?
So prevention of hearing loss is the thing that we have to focus on. Even the WHO is in this year's theme they have prevention or samrakshane or care for hearing. So that is protection of hearing. So protecting hearing is very important, because once it is lost, most of the kinds of hearing losses, okay, once it is lost, it is almost permanent hearing loss. Okay, so we have three parts of the ear: the outer ear, middle ear, and the inner ear. If the problem is in the outer or middle ear, the problem can be reversed to some extent by medicines or surgery. Whereas if the problem is in the inner ear, it cannot be reversed. So for that reason, we have to prevent. So as in any other problems, prevention is always better than cure, even with hearing loss. So prevention can be done through, like for example, a very loud exposure to very loud noises can lead to hearing loss. So in such cases, we will have to reduce exposure to loud sounds, we can take a call and then
Yes.
continue.
Hello. Hello.
ಮೇಡಮ್ ನಮಸ್ಕಾರ.
ನಮಸ್ತೆ. ನಿಮ್ಮ ಹೆಸರು
ಮೇಡಮ್
ಸರ್?
ಗುರು ಅಂತ ಮಾತಾಡೋದು ಬೀದರಿಂದ.
ಬೀದರಿಂದ. ನಿಮ್ಮ ಹೆಸರು ಗೊತ್ತಾಗ್ಲಿಲ್ಲ?
ಗುರುನಾಥ್ ಅಂತ.
ಗುರುನಾಥ್. ಹೇಳಿ ಸರ್.
ಮೇಡಮ್ ಈಗ ನನ್ನ ಮಗ ಅಲ್ಲೇ ಟ್ರೀಟ್ಮೆಂಟ್ ನಡೀತಿದೆ ಆಯುಷಲ್ಲೇ.
ಓಕೆ.
ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ, ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ದಟ್.
ಹಾ ಸರ್.
ಮತ್ತೆ ನನಗೆ ಇವಾಗ ಒಂದು ಸರಿ ಇತ್ತು ಮೇಡಮ್. ಈಸ್ ಅಬೌಟ್ 5 years ಆಗ್ತದೆ ಇವಾಗ ನೆಕ್ಸ್ಟ್ ಮಂತ್ ಅಲ್ಲಿ.
ಓಕೆ.
ನನಗೆ ಸ್ವಲ್ಪ ಹಿಯರಿಂಗ್ ಕೆಪಾಸಿಟಿ ಇದೆ ಮೇಡಮ್.
ಸರಿ ಸರ್. ಯಾವಾಗಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡಿಸ್ತಾ ಇದ್ದೀರಾ?
ಲಾಸ್ಟ್ 2 years ಮೇಡಮ್ ಅಲ್ಲೇ ಆಯುಷಲ್ಲೇ.
2 ವರ್ಷದಿಂದನೂ ಇದ್ದಾರೆ. ಓಕೆ. ಹೇಳಿ ಸರ್.
ಇವಾಗ ಸ್ವಲ್ಪ ಒಂದು ಕನ್ಫ್ಯೂಷನ್ ಇತ್ತು. ಲೈಕ್ ಅಂದ್ರೆ ಇವಾಗ ಸ್ವಲ್ಪ ಕೇಳಿಸೋದ್ರಿಂದ ಅವನಿಗೆ ನಾವು ರೆಗ್ಯುಲರ್ ಸ್ಕೂಲಲ್ಲಿ ಹಾಕ್ಬೋದಾ ಅಂದ್ರೆ ಒಂದಿಬ್ರು 3 ಸಜೆಷನ್ ಮಾಡಿತ್ತು.
ಓಕೆ.
ಅವನಿಗೆ ಸ್ವಲ್ಪ ಕೇಳಿಸುತ್ತೆ, ಸೊ ನೀವು ಚೆನ್ನಾಗಿರೋ ಹುಡುಗರು ಸಿಕ್ಕರೆ
ಓಕೆ.
ಸ್ಪೀಕ್ ಅಂತ ಹೇಳ್ತಿದ್ದಾರೆ.
ಓಕೆ. ಸರಿ ಸರ್.
ಹಾ.
ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಮಂಜುಳಾ ಮೇಡಮ್ ಇದ್ದಾರೆ. ಇದ್ರ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಮಾಹಿತಿ ಕೊಡ್ತಾರೆ.
ನೀವು ಮಗು ನಮ್ಮಲ್ಲೇ ತರಬೇತಿ ತಗೊಳ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ನಮ್ಮಲ್ಲಿ
ಹೌದು ಮೇಡಮ್.
ಸ್ಪೆಷಲ್ ಎಜುಕೇಶನ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್, ವಿಶೇಷ ಶಿಕ್ಷಣ ವಿಭಾಗ ಇದೆ. ಅಲ್ಲಿ ಸ್ಕೂಲ್ ರೆಡಿನೆಸ್ ಟೆಸ್ಟ್ ಅಂತ ಒಂದು ಮಾಡ್ತಾರೆ. ಅದರಿಂದ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗುತ್ತೆ ಮಗು ಯಾವ ಲೆವೆಲ್ ಅಲ್ಲಿ ಇದೆ. ಅಂದ್ರೆ ಮಗು ನಾರ್ಮಲ್ ಸ್ಕೂಲ್ಗೆ ಹೋಗ್ಬೋದಾ ಅಥವಾ ಮಗು ವಿಶೇಷ ಶಾಲೆಗೆ ಹೋಗ್ಬೇಕಾಗತ್ತಾ, ಏನು ಯಾವ ಮೀಡಿಯಂ ಕಲಿಬಹುದು, ಇದೆಲ್ಲ ಪರೀಕ್ಷೆಯಿಂದ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಸ್ಕೂಲ್ ರೆಡಿನೆಸ್ ಟೆಸ್ಟ್ ಒಂದು ಮಾಡ್ಸೋಣ ಮಗುಗೆ, ಆಮೇಲೆ ನಮ್ಗೆ ತಿಳಿಯುತ್ತೆ ಯಾವ ಲೆವೆಲ್ಗೆ ಯಾವ ಶಾಲೆಗೆ ಸೇರಿಸಬಹುದು ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ.
ಓಕೆ ಓಕೆ. ಅದು ಎಲ್ಲಿ ಸ್ಕೂಲಲ್ಲಿ ಮಾಡ್ಬೇಕಾ ಮೇಡಮ್ ಅಥವಾ
ಇಲ್ಲ ಇಲ್ಲ, ಇಲ್ಲಿ ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲಿ ತರಬೇತಿ ತಗೊಳ್ತಾ ಇದೆ ಅಲ್ವಾ ಮಗು?
ಹೌದು ಮೇಡಮ್.
ಇಲ್ಲಿ ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲಿ
ಮತ್ತೆ ಒಂದು ಸ್ಪೀಚ್ ಥೆರಪಿ ಮತ್ತೆ ಲಿಸ್ನಿಂಗು ಇದೆ.
ಅವ್ರು ಹೇಳಿ ನಮ್ಮನ್ನ ಬಂದು ಭೇಟಿ ಆಗ್ಲಿ, ಅವರು ವಿಶೇಷ ಶಿಕ್ಷಣ ವಿಭಾಗದಲ್ಲಿ ಭೇಟಿ ಆಗ್ಲಿ. ಅವರು ಡಾಕ್ಟರ್ ರಾಜ್ಕುಮಾರ್ ಅಂತ ಇರ್ತಾರೆ, ಅವ್ರನ್ನ ಭೇಟಿ ಆಗಿದ್ರೆ ಅವ್ರು ಗೈಡ್ ಮಾಡ್ತಾರೆ ಅವ್ರನ್ನ.
ಎಲ್ಲಿ ಮೇಡಮ್?
ವಿಶೇಷ ಶಿಕ್ಷಣ ವಿಭಾಗ,
Special
ವಿಶೇಷ
education
ಶಿಕ್ಷಣ ವಿಭಾಗ
department.
ರಾಜ್ಕುಮಾರ್ ಸರ್ ಅಂತ.
ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್, ಆಲ್ ಇಂಡಿಯಾ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಅಲ್ಲೇ ವಿಶೇಷ ಶಿಕ್ಷಣ ವಿಭಾಗ.
ಓಕೆ ಸರಿ ಮೇಡಮ್.
ಇನ್ನೇನಾದ್ರು
ಥ್ಯಾಂಕ್ ಯು
ಕೇಳೋದಿಲ್ಲ
ಮೇಡಮ್.
ಸರ್?
ಇಲ್ಲ ಮೇಡಮ್.
ಓಕೆ ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು.
Continue the discussion now. Prevention of hearing loss.
So like I was telling you that loud noise, we have to prevent exposure to loud noise or protect our hearing from loud noise, because once the damage is occurred due to loud exposures, then it is a permanent hearing loss. We can't repair that. So that was one way, because now the youth is in habit of listening to very loud music and all, and then the people who are working in factories and all are exposed to loud noises. So these people will have to develop a habit. For example, people listening to loud music and all, they have to develop a habit of listening the music at comfortable levels. That is, so when do we say that the loud music is very loud? Is that like when I'm listening to music using a headphone? Okay, if somebody has to speak to me very loudly, then I'm listening this music at a very loud volume. So we should take this rough measure, and we'll have to reduce the levels of exposure to even loud music. Even if it is music, even though we are enjoying, the ears are suffering. Okay, so the ears will not enjoy that loud exposure. So we will have to prevent that kind of a hearing loss. That is one way of doing it. The other way is like, if the child gets frequent colds and coughs and all, the upper respiratory tract infection, then also there are chances that this infections can, this upper respiratory tract infection like cold and all, they can spread to the middle ear, and then there can be some infection in the ear, and there can be ear discharge, which can lead to hearing loss. So in case the child gets frequent cough and cold, the child will have to immediately take medical consultation and follow the advice provided by the doctor, the ENT doctor. So that way also we can prevent the hearing loss. Okay, and always when we are taking medications and all, it has to be under the supervision of a doctor, because some of these medicines are ototoxic. In the sense, some medicines cause hearing loss. So these medicines have to be avoided, but in case they have to be taken for saving the life and all, we have to do it under supervision, and constant monitoring of hearing has to be taken up. And these are some of the ways of preventing hearing losses. And then it's we also have in our culture, we also have people marrying in blood relations. Even that can cause more chances for acquiring hearing losses. That should be avoided, yes.
ಹಲೋ
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 ನಮಸ್ತೆ
ನಮಸ್ತೆ, ಹೇಳಿ ಸರ್.
ನಮ್ಮದೊಂದು ಕ್ವಶನ್ ಇತ್ತು ಮೇಡಮ್.
ಸ್ವಲ್ಪ ಜೋರಾಗಿ ಮಾತಾಡ್ತೀರಾ?
ನಮ್ದೊಂದು ಕ್ವಶನ್ ಇತ್ತು
ಹೇಳಿ.
ಮ್ಯಾಮ್. ಇದು ಕಿವಿ ನೋವಿಗೆ ಇಯರಿಂಗ್ ಏಡ್ ಹಾಕೊಳ್ಳೇಬೇಕಾ?
ಕಿವಿ ನೋವಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕೋಬೇಕಾ ಅಂತ ಹೇಳಿ. ಓಕೆ, ಒಂದ್ ನಿಮಿಷ ಸರ್. ಓಕೆ, ನಮ್ಮ ಮೇಡಮ್ ಇದ್ದಾರೆ,
ಓಕೆ ಮೇಡಮ್.
ಇದ್ರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಕೊಡ್ತಾರೆ.
ಓಕೆ ಮೇಡಮ್.
ಕಿವಿ ನೋವು ಯಾವ ಕಾರಣದಿಂದ ಆಗ್ತಾ ಇದೆ ಅನ್ನೋದನ್ನ ನೋಡ್ಬೇಕಾಗತ್ತೆ. ಅವ್ರನ್ನ ತಾವು ENT ಡಾಕ್ಟರ್ ಹತ್ರ ಮೀಟ್ ಮಾಡಿದ್ರೆ ಅವರು ಅದನ್ನ ಔಷಧಿ ಮೂಲಕ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೋದಾ, ವಾಸಿ ಮಾಡ್ಬೋದಾ ಅನ್ನೋದನ್ನ ಹೇಳ್ತಾರೆ. ಸೊ ಕಿವಿ ನಾವು ಯೂಶ್ವಲಿ ಹೊರಗಡೆ ಅಥವಾ ಮಧ್ಯ ಕಿವಿಲಿ ಏನಾದ್ರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಬರ್ಬೋದು. ಈವನ್ ಗುಗ್ಗೆ ಗಟ್ಟಿ ಆದಾಗ, ತುಂಬಾ ಜಾಸ್ತಿ ಗುಗ್ಗೆ ಕಿವಿಲ್ ಸೇರಿದಾಗ, ಅಥವಾ ಕಿವಿ ಒಳಗಡೆ ಯಾವ್ದಾದ್ರು ಒಂದು ಹುಳು ಹೋದಾಗ, ಅಥವಾ ಅದ್ರೊಳಗಡೆ ಏನಾದ್ರೂ ಫಾರಿನ್ ಬಾಡಿ ಅಂತ ಹೇಳ್ತೀವಿ, ಹೊರಗಡೆ ಪದಾರ್ಥಗಳು ಏನಾದ್ರು ಸಣ್ಣ ಕಾಳು ಅಥವಾ ಏನಾದ್ರು ಆ ಥರದ್ದು ಏನಾದ್ರು ಕಿವಿ ಒಳಗಡೆ ಹೋದಾಗ, ಅದಕ್ಕೆ ನೀರು ಬಿದ್ದಾಗ ಅದು ದಪ್ಪಾಗಿ ಅವಾಗ ಕಿವಿ ನೋವು ಆಗ್ಬೋದು. ಆ ಥರ ಎಲ್ಲ ತೊಂದರೆ ಆಗೋದ್ರಿಂದ ನಾವು ENT ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಅಲ್ಲಿ ಸಲಹೆ ತಗೋಬೇಕಾಗತ್ತೆ. ಬರೀ ಕಿವಿ ನೋವಿದ್ರೆ, ಕಿವಿ ಕೇಳಿಸೋದ್ರಲ್ಲಿ ಏನು ಕಡಿಮೆ ಇಲ್ಲದೆ ಹೋದ್ರೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕೋ ಅವಶ್ಯಕತೆ ಬರೋದಿಲ್ಲ. ನೀವು ENT ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಸಲಹೆ ತಗೊಳ್ಳೋದು ಸೂಕ್ತ.
ಓಕೆ ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. Madam, you are talking about various ways to prevent hearing loss. One general question people ask is, because of aging, people get hearing problems. So can we prevent it? Is there something that we can do? And what are the types of problems they face?
So in old age, usually we have problems in eyesight also. We can also have problems in hearing due to aging. Okay, so this can be prevented by having, to some extent, this can be controlled by taking in good nutrition food, good diet, and also listening to music at comfortable levels and all that might help in decline in cognition and all in old age. So these are some of the exercises that we should follow. But if the hearing loss occurs due to old age, it's difficult to prevent that, because all of us age, and all of us, some of us or most of us might acquire hearing loss due to old age. And the typical symptoms are, because the specific pattern of that kind of a hearing loss in old age is, in some certain frequencies the person will be hearing better, and in certain frequencies the hearing will be poorer. So because of this reason, the person feels that he is hearing but he is not understanding speech. So he always says the other person is not speaking to me clearly. Okay, he has a problem, he has a problem, or she has a problem in their speech. So that kind of a conflict can be there. Okay, actually he is having a problem, but he says somebody else is not speaking clearly. So that kind of a sign or symptom can be seen in old age.
Thank you, ma'am. So continuing this discussion, so when there is a person with hearing loss, elderly person in the family, usually there will be issues in the family. So other family members find it difficult to cope with that person. So what is your suggestion to them, sir? How can we convince them to cope up with such individuals?
Yeah, the very first thing is they should understand the other person, the person who is having issues in the hearing. They should understand his situation, condition, and what way he is feeling. See, all the way, usually if it is acquired with the age process, see, all the way person was able to hear with a regular sound, but gradually he is he lost the ability. So obviously while watching the TV or answering the phone, they will be expecting the higher volume. So wherein other members in the family, they may not like the thing, because that may be a very higher pitch or higher volume for them. But they should understand why this person is increasing the volume and all, and they should support that, or maybe otherwise they have to go, they have to advise the family, the member person who is having hearing issue, maybe going with a hearing aid, so that that can balance that family environment. Also they should try to talk with face to face, so that a person can able to understand that, or maybe trying to boosting his or her confidence level. In fact, so obviously a person definitely feel low for that reason, that I am not able to hear for whatever the other person is saying. So there the family role comes out. They have to support in a way with a moral support, that they should push that, saying that. So it's quite common. So for any person to develop the hearing issues, so with the age, so that they can overcome with that, maybe with the other assistive device like hearing aid and other things. So these things they have to educate and they have to support with a person.
So if we have a person with hearing loss in the family, the elderly and all, other people in the family should also cooperate, and as you said, like they should talk to him slowly, clearly. So this will help him a lot to understand speech.
Thank you, ma'am. Adding to that, ma'am, usually those who have hearing problem, elderly, they tend to reject hearing device if at all it is suggested from an audiologist. So most of the time, they know that they have hearing problem. Even family members sometimes insist, but they don't want to use the hearing devices. So why do you suggest that they have to use a hearing device? Is it important for them? Can they manage without that?
So if they have problem in understanding speech or hearing speech, they have to definitely go in for a hearing device. Okay, so this group where the hearing loss in the elderly is a varied group. Some can have problem only in the inner ear. Okay, as I said earlier, there are 3 parts of the ear: outer, middle, and inner ear. So if the problem is only in the inner ear, then they can benefit more from a hearing aid. But if the problem is there in the nerve and the higher centers, okay, so then the benefit that the person will get from a hearing aid will be slightly limited. So we will have to counsel that person regarding what they can expect from a hearing aid. So if their expectations are more, then they will actually reject the hearing aid. So even before purchase of the hearing aid, we'll have to test them and see how much a hearing aid is going to be useful, and we should tell them regarding what to expect from a hearing aid, so that he continues to wear the hearing aid. Wearing the hearing aid is very important for him to adjust with the kinds of problems he may have due to hearing loss.
Thank you, ma'am. So regarding children having hearing problem, so as soon as parents identify that the child has hearing problem, it is a difficult phase for them to accept it. So what is your suggestion to them, sir?
Yes, we do see in our day-to-day practice that though child is detected hearing loss at a very early stage, there are instances that they never taken any hearing aid, or even though they have taken, they never used that on a regular basis, and definitely that will not serve any purpose. Thinking that using hearing aid as a stigma, most of the parents they do reject, or even maybe saying that child is not able to maintain that. Child may lose that hearing aid. So thinking that all the other giving all these reasons, people tend to reject or not using the hearing aid. But what we should say is that using hearing aid, it's not just only here to make a child to hear. Even in fact that helps in the other angle that already we discussed, that it influences on communication and all. So, and other psychological abilities that will improve.
Thank you, sir. We'll take this call. Hello? Hello?
ಮೇಡಮ್ ನಾವು ನಮ್ಮ ಮಗು ಬಗ್ಗೆ ಬಿಗ್ ಹೇಳಲ್ಲ, ಮಗು ಬಗ್ಗೆ ಮಾತಾಡಿ.
ಓಕೆ, ನಿಮ್ಮ ಹೆಸರು ಹೇಳ್ತೀರಾ?
ನನ್ನ ಹೆಸರು ಮಾಲಕ್.
ಎಲ್ಲಿಂದ ಕಾಲ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
ಮೇಡಮ್ ಹೋಗೋದಿಂದ, ಹಳ್ಳಿಗೆ ಹೋಗೋದಿಂದ ಕಾಲ್ ಮಾಡ್ತಿದ್ದೀವಿ.
ಓಕೆ, ಕೇಳಿ ಮೇಡಮ್, ಏನು ಕೇಳಬೇಕು ನಿಮ್ಮ ಮಗು ಬಗ್ಗೆ?
ಮಗು ಬಗ್ಗೆ ಏನು ಹೇಳಿದ್ರು ಕಷ್ಟ ಆಗಲ್ಲ, ನಮಗೆ ಕಿವಿ ಕೇಳಲ್ಲ, ಖುಷಿ ಮಾಡ್ತಿದ್ದೀವಿ. ಸ್ಕೂಲಲ್ಲಿ ಏನು ಹೇಳಿದ್ರು ನಮಗೆ ಗೊತ್ತಾಗ್ತಿಲ್ಲ.
ಓಕೆ, ಎಲ್ಲಿ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಸಿರೋದು ಮೇಡಮ್? ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಅಲ್ಲೇ ಮಾಡಿಸಿದೆ. ಹಿಯರಿಂಗ್ ಏಡ್ ಕೂಡ ಹಾಕ್ಸಿದ್ದೀರಾ? ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಸಿದ ನಂತರ ಏನಾದರೂ ತರಬೇತಿ ತಗೊಂಡಿದ್ರಾ?
ಇಲ್ಲ ಮೇಡಮ್, ಅವನಿಗೆ
ತರಬೇತಿ ಏನು ತಗೊಂಡಿಲ್ಲ. ಓಕೆ, ಇದ್ರ ಬಗ್ಗೆ
ತಗೊಂಡಿಲ್ಲ.
ಓಕೆ, ಈಗ ಶಾಲೆಯಲ್ಲಿ ತೊಂದರೆ ಆಗ್ತಾ ಇದೆ, ಏನ್ ಮಾಡಬೇಕು ಅಂತ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ಅಲ್ವಾ?
ಹೌದು ಮೇಡಮ್.
ಓಕೆ, ಇದ್ರ ಬಗ್ಗೆ ಉತ್ತರ ಕೊಡೋದಕ್ಕೆ ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಸಂಗೀತಾ ಮೇಡಮ್ ಇದ್ದಾರೆ.
ನೀವು ತುಂಬಾ ಒಳ್ಳೆ ಪ್ರಶ್ನೆಯನ್ನೇ ಕೇಳಿದ್ದೀರಾ. ನಾವು ಇದ್ರ ಬಗ್ಗೆ ಈಗ ಹೇಳಬೇಕು ಅಂತ ಇದ್ವಿ. ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಬರೀ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕಿದ್ರೆ ಸಾಲದು. ಈಗ ನೋಡಿ, ನಮ್ಗೆ ಏನಾದ್ರು ಕಣ್ಣು ಕಾಣಲಿಲ್ಲ ಅಂದ್ರೆ ನಾವು ಸ್ಪೆಕ್ಟಕಲ್ಸ್ ಹಾಕ್ತೀವಿ. ಸೊ ಅದರಿಂದ ಕಾಣುತ್ತೆ. ಅದಕ್ಕೇನು ನಮ್ಮ ಕಣ್ಣಿಗೆ ಟ್ರೈನಿಂಗ್ ಕೊಡೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಆದರೆ ಕಿವಿ ತೊಂದರೆ ಇದ್ರೆ ನಾವು ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕಿದ್ಮೇಲೆ ಖಂಡಿತ ಟ್ರೈನಿಂಗ್ ಅವಶ್ಯಕತೆ ಇದೆ. ಸ್ಪೀಚ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಥೆರಪಿ ಮತ್ತು ಲಿಸ್ನಿಂಗ್ ಟ್ರೈನಿಂಗ್ ಅಟೆಂಡ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಸೊ ಈ ಥರ ತರಬೇತಿ ಅಟೆಂಡ್ ಮಾಡೋದ್ರಿಂದ ಮಗುಗೆ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೂ ನಾವು ತರಬೇತಿ ಕೊಡಬೇಕು. ಬರೀ ಮೆಷಿನ್ ಹಾಕಿದಾಗ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಹೊರಗಿನ ಶಬ್ದ ಸ್ವಲ್ಪ ಜೋರಾಗಿ ಕೇಳಿಸುತ್ತೆ. ಆದರೆ ಇನ್ನು ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ಆ ಮಗು ಗಮನ ಕೊಡಬೇಕು. ಒಂದು ಶಬ್ದಕ್ಕೂ ಇನ್ನೊಂದು ಶಬ್ದಕ್ಕೂ ವ್ಯತ್ಯಾಸ ಏನು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಅರಿವು ಮೂಡಿಸ್ಬೇಕು ಅವ್ರ ಮಗುಗೆ. ಆಮೇಲೆ ಆ ಪದಗ ಒಂದು ನಾವೇನಾದರೂ ಒಂದು ಆಬ್ಜೆಕ್ಟ್ ತೋರಿಸೋದು, ಏನಾದ್ರು ಚಿತ್ರಗಳನ್ನು ತೋರಿಸಿದಾಗ ಎಲ್ಲ ಈ ಪದಕ್ಕೂ ಈ ಚಿತ್ರಕ್ಕೂ ಒಂದು ಸಂಬಂಧ ಇದೆ ಅಂತ ಈ ರೀತಿಯೆಲ್ಲ ನಾವು ಹೇಳ್ಕೊಡ್ಬೇಕಾಗತ್ತೆ. ಸೊ ಪ್ರತಿಯೊಂದು ಪದನೂ ನಾವು ಕೇಳಿಸ್ಕೊಂಡು ಮಾತಾಡ್ತೀವಿ. ಆದರೆ ಈಗ ಮಗುನಲ್ಲಿ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ತೊಂದರೆ ಇರೋದ್ರಿಂದ ನಾವು ಬೇರೆ ಮೋಡಲ್ಲಿ, ಅಫ್ಕೋರ್ಸ್ ಈಗ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೂ ಫಸ್ಟು ನೀವು ಈ ಹಿಯರಿಂಗ್ ಏಡ್ ಕರೆಕ್ಟಾಗಿ ಅವನಿಗೆ ಸೂಟ್ ಆಗ್ತಾ ಇದೆಯಾ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಚೆಕ್ ಮಾಡಬೇಕಾಗುತ್ತೆ ಆಯ್ತಾ. ಈಗ ನೀವು ಒಂದು ಸ್ವಲ್ಪ ಒಂದು 3 ತಿಂಗಳು ಒಬ್ಸರ್ವ್ ಮಾಡಿನೂ ಮಗು ಅಷ್ಟು ಕೇಳಿಸ್ಕೊತಾ ಇಲ್ಲ ಅಂತಂದರೆ ಇನ್ನೊಂದ್ಸಲ ಪರೀಕ್ಷೆ ಮಾಡಿಸೋದು ಒಳ್ಳೆಯದು. ಯಾಕಂದರೆ ಸ್ವಲ್ಪ ಬೆಟರ್ ಹಿಯರಿಂಗ್ ಏಡು, ಬೆಟರ್ ಆಂಪ್ಲಿಫಿಕೇಶನ್ ಇರುವಂಥ ಒಂದು ಹಿಯರಿಂಗ್ ಏಡು ಕೊಡಬೇಕಾಗತ್ತೆ. ಸೊ ಯಾವಾಗ ಮಗು ಚೆನ್ನಾಗಿ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ಶುರು ಮಾಡ್ತಾನೋ ಆವಾಗ ಮಾತಿನ ಬೆಳವಣಿಗೆ ಚೆನ್ನಾಗಾಗುತ್ತೆ. ಆದರೆ ಕೆಲವು ಮಕ್ಕಳಲ್ಲಿ ಎಷ್ಟೇ ಒಂದು ಒಳ್ಳೆ ಆಂಪ್ಲಿಫಿಕೇಶನ್ ಡಿವೈಸ್ ಕೊಟ್ಟರೂ ಮೇ ಬಿ ಹಿಯರಿಂಗ್ ಲಾಸು ತುಂಬ ಪ್ರಾಬ್ಲಮ್ ಇರೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಕೇಳಿಸ್ಕೊಳ್ಳೋದ್ರಲ್ಲಿ ಆ ಕ್ಯೂಸ್ ಸ್ವಲ್ಪ ಸಿಗ್ದಲೇ ಇರ್ಬೋದು. ಅಂಥ ಸಮಯದಲ್ಲಿ ನಾವು ಬೇರೆ ಥರದ್ದು ಕ್ಯೂಸ್ ಕೊಟ್ಬಿಟ್ಟು, ಅಂದರೆ ನೋಡು ಅದನ್ನ ಒಂದು ಅಕ್ಷರನ ಯಾವ ರೀತಿ ಹೇಳ್ತೀವಿ ಅದನ್ನು ನೋಡೋದು, ಅಥವಾ ಅದು ಸ್ಪರ್ಶಗಳ ಅನುಭವದ ಮೂಲಕ ಈ ರೀತಿ ನಾವು ಮಾತಿನ ತರಬೇತಿನಲ್ಲಿ ಹೇಳ್ಕೊಡ್ತೀವಿ. ಸೊ ಹೀಗೆ ಕೆಲವು ಸ್ಟ್ರಾಟಜೀಸ್ಗಳನ್ನು ನಾವು ಉಪಯೋಗಿಸಿ ಮಾತನ್ನು ಕಲಿಸ್ಬೋದು. ಸೊ ಖಂಡಿತ ಸ್ಪೀಚ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಥೆರಪಿನ ಅಟೆಂಡ್ ಮಾಡಿದ್ರೇ ಮಗುನಲ್ಲಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಸಾಧ್ಯ. ಬರೀ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಬಿಟ್ಟು ಮಾತು ಬರುತ್ತೆ ಅಂತ ದಯವಿಟ್ಟು ಇದನ್ನು ನಂಬೇಡಿ. ಆ್ಯಂಡ್ ಇಟ್ಸ್ ಅ ಮಿತ್. ಇದನ್ನು ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ತಿಳ್ಕೊಳ್ಬೇಕಾಗಿರೋದು, ಬರೀ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕೋದು ಸೊಲ್ಯೂಷನ್ ಅಲ್ಲ. ಹಿಯರಿಂಗ್ ಇಂಪೇರ್ಮೆಂಟ್ ಇದ್ದರೆ ಬರೀ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಬಿಟ್ರೆ ಮಾತು ಬರುತ್ತೆ ಅಂತ ಅಂದ್ಕೊಳ್ಳೋದು ಖಂಡಿತ ತಪ್ಪು. ಗೊತ್ತಾಯ್ತಮ್ಮ?
ಮತ್ತೇನಾದ್ರು ಕೇಳೋದಿತ್ತಾ?
ಇನ್ನೇನಿಲ್ಲ ಮೇಡಮ್.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು. Madam, when we are talking, we spoke about hearing aids, we spoke about cochlear implant. So, is there any difference in result that we get in child wearing hearing aid or child wearing cochlear implant?
So usually there is a difference between the hearing aid and the cochlear implant as well. The hearing aid is given for lesser degrees of hearing loss, whereas cochlear implant is given for a higher degree of hearing loss. So when a person has got a severe or profound hearing loss, this person will benefit more from a cochlear implant than from a hearing aid. Okay, so he will get cues in the high frequencies. For example, earlier Dr. Sangeeta was saying plurals, possessives and all these sounds are difficult to acquire. So these sounds become easier to acquire when they are wearing the cochlear implants because their frequency range itself is more. The high frequencies are perceived better from a cochlear implant. So that way, for that particular degree of hearing loss, severe to profound degree of hearing loss, a cochlear implant would be more useful. Whereas for other degrees, lesser degrees of hearing loss, a hearing aid can be continued to use. Okay, and with that and appropriate amount of training, as earlier it was emphasized, with both the devices, appropriate amount of training is very important.
Thank you, ma'am. Madam, one of the callers, she was telling that hearing aid was put to the child, but they didn't come for speech language therapy.
Yes.
This happens for many children. They come very late, maybe after 10 years. They would have taken the hearing aid quite early. So if they come very late, maybe more than 10 years of age, so is there, can we see the same result?
No. Actually, see, we have something called critical language concept. So our brain is in a kind of plasticity during the early age. So this is the process, during the early age, it's important that every sensory stimulation should be given to the child. Okay, it may be language, visual, auditory, tactile, every kinesthetics. All this sensory stimulation is a must for the child's growth. So in case the child loses any kind of these sensory stimulation, then obviously there's going to be a developmental issues with regard to the respective sense. So hence this critical language concept of the critical age concept plays a major role. That is why we always emphasize on early identification and early intervention. So the brain is like, a sponge which would absorb from the environment. So whatever input is given, the brain is going to absorb a lot from the environment during the early years. So hence, in case a child has issues, then it has to be identified early, as ma'am said, 1 month, 3 months, 6 months. So this is the criteria for hearing impairment. So that the phases needs to be looked into, and then we have to focus on intervention, and then especially with regard to the hearing impairment, they need to attend training. They need to attend training with regard to speech language skills and also the auditory verbal skills. Okay, so that's the major issue.
We have another call, ma'am.
Yeah.
Hello.
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 Good afternoon, ma'am.
Good afternoon. Hey, sir.
I am from Kerala. Can I talk in English?
Yes, sure. Your name, sir?
Arun.
Okay.
Okay, this is for my brother. He's in 8th standard now.
Okay.
So he's telling like he can hear things, sound, all those things he can hear, but the speech or whatever we are telling him is not able to understand it. Like kind of muffled noise or something.
Okay. Is he using any hearing device like hearing aid?
Actually, we consulted a private clinic, audiology vision hearing clinic.
Okay.
So we tried with the hearing aid, but that is not beneficial for him. Like it is too much loud for him. So the audiologist also told there is no hearing loss as such, but the speech is not understanding.
Okay. So your brother does not have hearing loss, but is not able to understand speech clearly. That is the question, right, sir? What can be done? That's what we want to know.
Yes.
Okay. With us, we have Dr. Manjula, ma'am. She'll be answering your question. Over to you, ma'am.
So I appreciate your concern for your brother's hearing. So this is, if the audiologist whom you consulted has told you that the child does not have a hearing loss, there can be other problems like higher level problems. Okay, so it can be a problem in the hearing nerve, or it can be problem in the auditory pathway or in the higher centers of the brain. So I'm not saying that the child has, but we have to confirm that through diagnostic tests. Okay, so the detailed diagnostic tests, apart from the routine audiological tests, have to be done in order to say whether the child has other problems or not. So in case the child has other problems, other management techniques will have to be undertaken in case the child has such a problem.
Okay, they have done this test, BERA or something like that.
What does it show?
BERA, so it is absent, so there might be problem in nerve. So that is why it is come.
So they said it is absent.
So yeah, so what is this BERA test? How is it different from the other test?
BERA is an objective test which will assess the function of the entire auditory system, specifically more with reference to the auditory pathway that is beyond to the level of the brain stem. So the thing is, like if the child has problem in in the hearing nerve, or sometimes there can be problems with synchronous firing of these auditory nerve and all. So in case the child has a problem like that, BERA can be absent. So in such cases, alternate modes of management will have to be instituted. It could be a cochlear implant. Some children do well with a cochlear implant, but we will have to do electrical BERA, an electrically evoked BERA, to find out if the child can benefit from a cochlear implant in such instances. So further tests have to be done to say what is the management approach that we need to follow for this child.
Okay. Actually, the thing is, I browsed through this internet and all. So, like, I got some information like some neuropathy, something like that. So,
auditory neuropathy. Auditory neuropathy is what
auditory neuropathy or something.
Yeah. That it could be that. So, if the problem is confirmed through diagnostic tests, the management would be different. The child will not benefit that much. All children with auditory neuropathy will not benefit to the same extent with a hearing aid. So, other forms of management will have to be considered. If you can please come to our institute.
Modes, like, is it available in Kerala?
It can be. You can check in certain audiological centers. They do these electrically evoked brainstem evoked response audiometry. That is electrically evoked BERA. They will do. So if there is an electrically evoked response, then the child may benefit from a cochlear implant.
But he is now 13 is over, 14 years old. So for some cochlear implants, because
Apart from cochlear implant, you have other modes of communication, something like AAC ಬಗ್ಗೆ ಹೇಳ್ಬೋದು.
Can he go for cochlear implant? Sir, is your question, can he go for cochlear implant at this age?
Yes, I asked that.
Yeah. The child, if the child gets electrically evoked response, then the child can go in for a cochlear implant, but the expectations will have to be moderate. Okay, so if the child was implanted at a very early age, then the benefit would have been more compared to the implantation done at this age.
Okay, ma'am. Thank you. Thank you.
Thank you. I think we are nearing the end of the session. Madam, is there any take-home message you would like to give our audience?
So I would like to tell the audience that they have to take care of their ears very well to prevent the hearing loss from occurring. Apart from that, in case the child is, if anyone has got a hearing problem, then it has to be assessed quick at an early stage, and then the hearing aid or an appropriate hearing device has to be recommended. Okay, and this has to be done by an audiologist.
Sorry, ma'am. Shall we take
Yes,
this last
yes.
call? Hello? Hello?
ಹಲೋ ಮೇಡಮ್,
ಹೇಳಿ.
ನನ್ನ ಮಗನಿಗೆ ಕಿವಿ ಕೇಳಿಸಲ್ಲ, ಇದು 2 ಕೊಡ್ಸಿದ್ದೀನಿ, ಮತ್ತೆ ಸ್ವಲ್ಪ ತೊದಲ್ತಾನೆ. ಅವನಿಗೆ ಥಿಯರಿ ಎಲ್ಲ ಕೊಡ್ತಾ ಇದ್ದೀವಿ, ಥೆರಪಿ, ಅಂದ್ರೂ ಏನು ಪ್ರಯೋಜನ ಆಗ್ತಿಲ್ಲ, ತುಂಬಾ ಬೇಜಾರಾಗುತ್ತೆ. ಯಾಕೆ?
ಎಷ್ಟು ವಯಸ್ಸು ನಿಮ್ಮ ಮಗನಿಗೆ?
ಅವ್ನಿಗೆ 11.
ಇಯರಿಂಗ್ ಏಡ್ ಯಾವಾಗ ಹಾಕ್ಸಿದ್ರಿ?
ಅವ್ನಿಗೆ ಹಾಕಿ ಯಾವಾಗಲೇ ಒಂದು 8-9 ತಿಂಗಳಾಯ್ತು.
8-9 ತಿಂಗಳಾಯ್ತಾ? ಓಕೆ.
ಹಾ.
ತರಬೇತಿ ಕೊಡ್ಸಿದ್ದೀರಾ?
ಕೊಡಿಸ್ತಾ ಇದ್ದೀನಿ, ಅಂದ್ರೆ ಏನೂ ಪ್ರಯೋಜನ ಇಲ್ಲ.
ಓಕೆ. ಎಷ್ಟು ಕಿವಿ ತೊಂದರೆ ಇದೆ ಅಂತ ಹೇಳಿದ್ದಾರೆ?
ಒಂದು.
ಒಂದೇ ಕಿವಿ ತೊಂದರೆನಾ ಅಥವಾ 2 ಕಡೆನಾ?
ಇಲ್ಲ, ಒಂದು ಕೇಳಿಸುತ್ತೆ, ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಇದು.
ಓಕೆ. ಇನ್ನೊಂದು ಒಂದು ಕಿವಿಯಲ್ಲಿ ಮಾತ್ರ ತೊಂದರೆ ಇರೋದು ನೀವು
ಹಾ,
ಹೇಳೋ ಪ್ರಕಾರ. ಮಾತು ತೊದಲುತ್ತೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಲ್ಲ, ಏನ್ ತೊಂದರೆ ಇದೆ ಆಕ್ಚುಲಿ?
ಅವ್ನು ಸ್ವಲ್ಪ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಸ್ವಲ್ಪ ತೊದಲ್ತಾನೆ. ಅವನು
ಓಕೆ.
ಏನಾದ್ರು ಹೇಳಿದ್ರೆ ಡಬಲ್ ಹೇಳ್ತಾನೆ.
ಓಕೆ. ಈಗ ತೊಂದರೆ ಅಂದ್ರೆ ಕೇಳಿಸ್ಕೊಳ್ತಿಲ್ಲ ಅಂತನಾ ಅಥವಾ ಮಾತಿಗೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದ?
ಸರಿಗೂ ಕೇಳಿಸಲ್ಲ, ಮತ್ತೆ ಮಾತುನು ಸರಿಗೆ ಅವನು ಸ್ಪಷ್ಟವಾಗಿ ಮಾತಾಡಲ್ಲ.
ಓಕೆ. ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಮಂಜುಳಾ ಮೇಡಮ್ ಇದ್ದಾರೆ, ಇದ್ರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಕೊಡ್ತಾರೆ.
ಓಕೆ ಮೇಡಮ್.
ಮಗುಗೆ 2 ಕಿವಿಗೆ ತೊಂದರೆ ಇದ್ದು ನೀವು 1 ಕಿವಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ತಾ ಇದ್ದೀರಾ ಅಥವಾ
ಎರಡೂನು? ಯಾಕಂದ್ರೆ ಒಂದ್ರಲ್ಲಿ ಸ್ವಲ್ಪ ತೊಂದ್ರೆ, ಇನ್ನೊಂದು ಪರವಾಗಿಲ್ಲ. ಓಕೆ ಓಕೆ.
ಇನ್ನೊಂದ್ರಲ್ಲೂ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಮಾತ್ರ ತೊಂದರೆ ಇದ್ರೂ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಬೇಕಾ ಬೇಡ ಅನ್ನೋದು ನಿಮ್ಗೆ ಹೇಳಿದಾರ? ಬೇಡ ಅನ್ನೋದು ಹೇಳಿದಾರಾ?
ಇಲ್ಲ, ಹಾಕಿ ಅಂತ ಹೇಳಿದ್ದಾರೆ.
2 ಕಿವಿಗೂ ಹಾಕ್ಬೇಕಮ್ಮ. 2 ಕಿವಿಲೂ ತೊಂದರೆ ಇದ್ರೆ 2 ಕಿವಿಗೂ ಹಾಕ್ಬೇಕಾಗುತ್ತೆ. 2 ಕಿವಿಗೂ ಹಾಕ್ಬಿಟ್ಟು ಟ್ರೈನಿಂಗ್ ಕೊಡ್ಬೇಕು. ಈಗ 11ನೇ ವಯಸ್ಸಿನಲ್ಲಿ 9 ತಿಂಗಳಿಂದ ಹಿಯರಿಂಗ್ ಏಡ್ ಉಪಯೋಗಿಸ್ತಾ ಇದ್ದೀರಾ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ಸ್ವಲ್ಪ ನಿಧಾನ ಆಯ್ತು ಇದು. ಈಗ ನೋಡಿ, ಈಗ ಹುಟ್ಟೋ ಮಗು 1 ವರ್ಷದಲ್ಲಿ ಮಾತಾಡುತ್ತೆ, ಅಮ್ಮ ಅಪ್ಪ ಅಂತ ಹೇಳುತ್ತೆ ಅಂದ್ರೆ, ನೀವು 11ನೇ ವರ್ಷ ಅಂದ್ರೆ 10 ವರ್ಷ ಡಿಲೇ ಬಂದ್ಬಿಟ್ಟಿದೆ ಈ ಮಗುನಲ್ಲಿ ಆಲ್ರೆಡಿ. ಸೊ ಇದನ್ನ ನಾವು ಗ್ಯಾಪ್ ನ ತುಂಬಬೇಕಾದ್ರೆ ತುಂಬಾ ಟ್ರೈನಿಂಗ್ ಕೊಡ್ಬೇಕಾಗತ್ತೆ. ಅಂಡ್ ಮಗು ನಾರ್ಮಲ್ ಆಗಿ ಮಾತಾಡ್ತಾನೆ ಅಥವಾ ನಾರ್ಮಲ್ ಆಗಿ ಕೇಳಿಸ್ಕೊಂಡು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ತಾನೆ ಅನ್ನೋದನ್ನ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡಕ್ ಆಗೋದಿಲ್ಲ. ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಮಾತ್ರ ಅಕ್ವೈರ್ ಮಾಡ್ಕೊಳ್ತಾನೆ ಸ್ಪೀಚ್ ಅಂಡ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಸ್ಕಿಲ್ಸ್ ನ. ಸೊ ತರಬೇತಿ ಮೇಲೆ ಡಿಪೆಂಡ್ ಆಗುತ್ತೆ. ಸೊ 2 ಕಡೆಗೂ ಕಿವಿಗೆ ಮಿಷನ್ ಹಾಕ್ಬೇಕು, ಜೊತೆಗೆ ತರಬೇತಿನೂ ಕೊಡ್ತಾ ಬರ್ಬೇಕು. ತರಬೇತಿ ಇದು ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಕಲಿತಾನೆ ಅನ್ನೋದು ಸಂಗೀತ ಮೇಡಮ್ ಹೇಳ್ತಾರೆ.
ಅದೇ ಈಗ ತರಬೇತಿ ಸ್ವಲ್ಪ ಅದೇ ನಾವಿಲ್ಲಿ ಏನು ತರಬೇತಿನಲ್ಲಿ ಏನು ಹೇಳ್ಕೊಟ್ಟಿರ್ತಾರೆ ನಮ್ಮ ಥೆರಪಿಸ್ಟು, ಅದೇ ತರ ನೀವು ಮನೆಯಲ್ಲಿ ಸ್ವಲ್ಪ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಆಮೇಲೆ ನಾವು ನಮ್ಮ ಚಟುವಟಿಕೆಗಳು ಆಕ್ಟಿವಿಟಿ ಎಲ್ಲ ಸ್ವಲ್ಪ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಆಗಿದ್ರೆ ಮಗುಗೂ ಇಂಟ್ರೆಸ್ಟ್ ಇರುತ್ತೆ ಮಾಡೋದಕ್ಕೆ. ಮತ್ತೆ ದಿನನಿತ್ಯ ನೀವು ಮಾತಾಡೋದು ಬರೀ 1/4 ಗಂಟೆ ಒಂದು ತರಬೇತಿ ಕೊಡೋದಕ್ಕೆ ಅಷ್ಟೇ ಆಗ್ಬಾರ್ದು. ಮಾಮೂಲಿ ತರ ನ್ಯಾಚುರಲ್ ಎನ್ವಿರಾನ್ಮೆಂಟ್ ಅಲ್ಲೇ ಮನೆಯಲ್ಲೇನೆ ಏನ್ ಕೆಲಸ ಮಾಡ್ತಾ ಇರ್ತಾನೋ ಅದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂಗೆ ಮಾತಾಡಿಸ್ಬೇಕು. ಹಾಗೆ ನೀವು ಆ ಒಂದು ಸಂದರ್ಭ ತಕ್ಕಂತೆ ಮಾತಾಡ್ತಾ ಇರ್ಬೇಕು. ಸೊ ಅದಕ್ಕೆ ಒಂದು ಮೀನಿಂಗ್ಫುಲ್ ಆಗಿರ್ಬೇಕು. ಸೊ ಅವನಿಗೂ ಮಾತಿನ ಅವಶ್ಯಕತೆ ಇದೆ ಅನ್ನೋದು ಅನ್ನಿಸ್ಬೇಕು. ಸೊ ಅದರಿಂದ ಅವನಿಗೂ ಒಂದು ಆಸಕ್ತಿ ಬೆಳಿಬೇಕು. ಸೊ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ನನಗೆ ತೊಂದರೆ ಇದೆ ಅನ್ನೋದು ಆಕ್ಸೆಪ್ಟೆನ್ಸ್ ಮಾಡ್ಕೋಬೇಕು. ಅದಕ್ಕೆ ತಕ್ಕಂತೆ ಆ ಸಂದರ್ಭಕ್ಕೆ ಅನುಸಾರವಾಗಿ ನಾನು ಮಾತಾಡಬೇಕು ಅನ್ನೋ ಒಂದು ಆಸಕ್ತಿ ಅವನಿಗೆ ಬೆಳೆದ್ರೆ ಖಂಡಿತ ಅವನ ಮಾತು ಇಂಪ್ರೂವ್ ಆಗುತ್ತೆ. ಈಗ 11 ವರ್ಷದ ಹುಡುಗಂಗೆ ತುಂಬಾ ತಿಳುವಳಿಕೆ ಇರುತ್ತೆ. ಸೊ ಅವನಿಗೂ ಗೊತ್ತಿರುತ್ತಲ್ವಾ ಮಾತಿನ ಅವಶ್ಯಕತೆ ಇದೆ ಅಂತ. ಸೊ ಇದಕ್ಕೆ ನಿಮ್ಮ ಸಪೋರ್ಟು ತುಂಬಾ ಮುಖ್ಯ ಆಗುತ್ತೆ. ಸೊ ಇಲ್ಲಿ ಹೇಳ್ಕೊಟ್ಟಿದ್ದ ಹಾಗೆ ನೀವು ಮನೆಯಲ್ಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿ ಖಂಡಿತ ಇಂಪ್ರೂವ್ ಆಗ್ತಾನೆ. ಒಂದು ಸ್ವಲ್ಪ ಆಸಕ್ತಿ ಅದರಲ್ಲಿ ಬೆಳೆಸಿ ಆಗುತ್ತೆ.
ಓಕೆ ಓಕೆ ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ತುಂಬಾ ಕಾಲ್ಸ್ ಬರ್ತಾ ಇದೆ ಮೇಡಮ್ ಬೇರೆ ಬೇರೆ ಕಡೆಯಿಂದ, ಬಟ್ ವಿ ಹ್ಯಾವ್ ಆಲ್ಮೋಸ್ಟ್ ರೀಚ್ ದ ಎಂಡ್ ಆಫ್ ದ ಸೆಷನ್. ಮೇಡಮ್ ಇನ್ನೇನಾದ್ರೂ ಹೇಳೋದಿಲ್ಲ?
ಹಿಯರಿಂಗ್ ಏಡ್ ಆದಷ್ಟು ಬೇಗ ಹಾಕ್ಸಿ. ಆ ಮಗುಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ಸ್ಬೇಕಾದ್ರೆ ಆಡಿಯೋಲಜಿಸ್ಟ್ ಹತ್ರನೇ ಹೋಗಿ ತಗೊಳ್ಬೇಕಾಗತ್ತೆ. ಅಮೆಝಾನ್ ಅಥವಾ ಇನ್ಯಾವುದೋ ಆನ್ಲೈನ್ ಸ್ಟೋರ್ಗಳಲ್ಲಿ ತಗೊಳ್ಬಾರ್ದು, ಯಾಕೆಂದ್ರೆ ಅವರು ಪರೀಕ್ಷೆ ಮಾಡಿ ಕೊಟ್ಟಿರೋಲ್ಲ, ಎಷ್ಟು ಕಿವಿ ತೊಂದರೆ ಇದೆ ಅಂತೆಲ್ಲ ನೋಡಿ ಕೊಟ್ಟಿರೋಲ್ಲ. ಸೊ ಆದಷ್ಟು ಆಡಿಯೋಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗ್ಬಿಟ್ಟು ಅವ್ರ ಸಲಹೆ ಪಡೆದು ಹಿಯರಿಂಗ್ ಏಡ್ ನ ತಗೊಳ್ಬೇಕಾಗತ್ತೆ ಅವಶ್ಯಕತೆ ಇದ್ದಲ್ಲಿ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. Madam, in our final comments.
Yeah. So once the child is suited with the appropriate amplification device, it's necessary that the child attends speech language therapy and auditory verbal therapy. So practice, practice, practice. This is a major important, the word you have to follow. The parents and the child has to follow, and I'm sure such children will really progress and succeed.
Thank you, ma'am. Sir, anything you would like to add?
See, one thing I just want to highlight, one study of ours, where we found, I did, community exposure, what a child gets, especially, blind and hearing impaired child. The very interesting finding what we noticed is, the child with a blind or visually impaired, so taken to the movie theater and all, or mall and all, wherein the hearing child, child with hearing issues not being. So that shows that how much people are taken in a kind of a stigma, or thinking that they are concluding in their level that the child is not able to hear, so what is the use taking there? So this is what kind of stigma what we have. Here I would like to say that any child for that matter definitely have a potential to learn anything, provided we give the opportunity or environment. So please create that environment, and definitely whatever child is with a disability, definitely child learn that.
Yes. To conclude, they have every right to live like a normal person.
Yes. Thank you, ma'am. So far, all of you have given so much of information to our audience, and many of them called and got their solution for whatever questions they had. A heartfelt thank you to all three of you for giving us so much of information and helping our audience and listeners. Thank you so much. I also extend my thank you to Mr. Rajkumar sir for sign language interpretation. My thanks even is to all the organizers and people who are working hard behind the screen. Finally, special thanks to all our audiences and people who called to get the information. Thank you, one and all.